Good evening and welcome to today's webinar, Anxiety Treatment with Psychotherapy, Natural Medicine and Healthy Lifestyle. To all of you, thank you for making your time out and being here today. Let me introduce our honorable speaker of this webinar, Dr. Edward Chan, a PhD holder in Psychology and completed Master of Science in Learning and Master in Nutritional Medicine. Bachelor of Science Honors in Psychology and Postgraduate Diploma in Corporate Psychology. He is also the Principal Consultant at PsyCorp, a Center for Corporate Psychology, and Board Certified Corporate Therapist with the Malaysian Association of Psychotherapy and the International Society for Psychotherapy, Counselling and Psychiatry Fellow of the World Council for Psychotherapy. And apart from all this astounding education and professional background, Dr. Edward is also an invited speaker for the 9th World Congress for Psychotherapy for the year of 2020, keynote speaker for the 4th International Psychotherapy, Counselling and Psychiatry Conference 2020, and invited speaker for the 34th European Psychiatry Conference on Schema therapy. And not to forgotten, Dr. Edward has done his remarkable contribution to the world through his writings, as he is also the author of several books entitled Dancing with Crocodile, Key Strategies of Corporate Psychology, and Love is Never Enough. Apart from that, multiple of his works have been published in the Journal of Cognitive Therapy and Research, Journal of Reattached Therapy, and Developmental Diversity, International Journal of Psychiatry, and he is also an accredited reattached therapist. Ladies and gentlemen, here to discuss more on anxieties, please welcome Dr. Edward Chan. Hello, doctor. How are you today?
I'm good. How are you, Kamini? Good to hear from you. And of course, Kamini is good to hear from you. And of course, Kamini is one of our graduate students that you have completed 3 professional certification courses in adult psychological assessment, psychotherapy, and emotion-focused therapy, right?
Right. It's remarkable that you can remember what courses I take, and you have like a lot of students actually.
No worries. I noticed from my picture I'm a little bit slanted. I hope it will get adjusted. Do you see me like the wrong way up, or?
Yeah, it's actually instead of horizontal, it's vertical actually. So is there a way to change the screen resolution or something?
I think it might sort of adjust itself in a moment. I hope. Right.
Got it.
Yeah,
all right.
Yeah. So we'll continue on and see what happens. I can like make it a bit smaller, and then but let's get started and
all right.
see.
And dear audience, we will be running a live Q&A session at the end of this webinar, so you may actually turn on your camera and ask any questions directly to doctor, or you can also write down your questions at the chat forum, which I will be reading out during Q&A session. And if you miss anything, don't worry, these recordings will be available in International Psychology Center Facebook or YouTube channel. So I'm going to start this session today with a poem, and here it goes, right? Anxiety has locked me in a cage. It's a feeling I can't seem to gauge. Escape is not an option here. I am living in a state of fear. I can know that I am fine, but my mind is no longer mine, which means I panic at everything and I can't handle what life can bring. I try to survive just one more day, doing anything to find a way. But I feel I would be better dead without this monster in my head. This is a poem about anxiety and how the world looks like from the perception of a person suffering with anxiety. Doctor, let's talk more about this. What is anxiety, and are those symptoms explained in the poem is normal or way too exaggerated?
I think I can see a lot of truth in that. So certainly, when you are having anxiety, you are locked, in I wouldn't say in your own mind per se, but in one part of your mind, right? As I'm going to will be talking, we want to introduce the concept that. There are many aspects of us, psychologists call that multiple selves, right? I mean, the idea was first in fact introduced by Freud himself, which is the father of psychology and psychotherapy. And he talk about the subconscious, and he introduced the idea of the subconscious, but also the id, which is like a basic self, the ego, the super ego, ourselves from society. So that those concepts have continued to be used widely by psychologists. So when you are having a lot of severe anxiety, then it seems that we are locked in part of ourselves, maybe like the fearful self, the self that feels very vulnerable to harm. And then as a result, we might try to defend against that, right? I just work with some patients today, and one of the things that he was doing was to detach himself, because he gets a lot of like attack and criticism, from his family members, but as a result, he cannot also connect with his partner as well, so that is a problem if he get locked in one of these self or aspects, right? Then we cannot do other things. It's like when you detach, we cannot seems to be detached only from pain, but we detach also from joy. So we cannot seem to be selective a lot of the time, when we are anxious. But we're going to talk more on how to navigate around being locked and stuck in what we call the primary cell, the protective cell, and learn to be more vulnerable, more brave, as some psychologists like Brené Brown call it braving, right?
Right. Yeah. So based on the formulation that you just presented, how is anxiety disorder is related to this, doctor?
Well, so anxiety is a situation, whereby the patient might have like an overestimation and get caught in a prediction of danger. All right. So that might have something to do with what we call Schema, which is a psychological program developed from childhood. So maybe they have this vulnerability to harm Schema. So maybe they experience or perceive a lot of lack of safety. So we all have needs, as childhood. One of the, of course, basic childhood need is for safety. Not only physical safety but also emotional safety. Right, to be validated, to be recognized, to be nurtured. So when this is not available, then a lot of people then do not feel safe. Then they also start predicting that things may not be safe in the future, and this is the seeds of anxiety when you have a lot of negative predictions about events. Yeah. So it's a combination of your schema, of your thought process, your coping mode, and then also it comes about from the way you cope. All right. So this is what we call modes, your coping behavior. So a lot of people in order, I know you probably heard of OCD, Obsessive Compulsive Disorder, which is in fact a form of anxiety. you know. So anxiety can take many forms in terms of psychological disorders. Not only you have like general anxiety disorder, you have phobia, you know, you have social phobia, you have a obsessive compulsive disorder, you know, they all come under anxiety. So many of these coping methods are about avoiding anxiety. All right. So just like OCD, you know, I don't know, you know, if you're familiar with OCD, then one of the things that they do might be keep on checking the logs, you know, checking it 20 times, while washing their hands in case the burglar come in or they get germs. I think now they're probably a lot higher incidence of OCD. Yeah. So you know, I think probably most people would have some signs of OCD, right? So this, but that's a good question. Why do some people develop OCD and some do not? You know, it is to do again with your program, right? With your schema, right? So the problem with this checking behavior, you know, and another behavior, this is what we call avoidance coping. Right, so you hope by checking the door 10 times or washing your hand for half an hour, you won't get the germs, right? So but in reality, you are avoiding the anxiety. You hope to avoid the anxiety, right? The pain, the vulnerability, right? So the problem with that is it sets it feels anxiety, you know, it feels it, right? Because you don't get to experience what would happen if you don't do this avoiding behavior. All right, you don't get to see that, you know, if you don't check and things that you might actually be okay, you know, if you you know, don't wash your hand for half an hour, you know, you might not actually get COVID, you know, but you don't get to experience that. So the behavior, the avoidance reinforce, you know, the anxiety behavior, right? So that's why in therapy we do something called exposure therapy, right? So it's a behavioral therapy to help the patient to really experience, you know, being vulnerable.
Right.
There's a lot there.
Interesting. Yes. So from your explanation, so what we could understand is there are several types of anxiety disorders, and I guess the most major 6 types, some of those that you mentioned will be general anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder, panic disorder, social anxiety
I'm going
disorder.
to try to close this and see whether I can open with the right way around. So if I get disconnected, I'm going to come in, but you can carry on.
I will go on.
All right. Yeah.
So usually this general anxiety disorder, it's an excessive worrying about various issues with no cause or trigger, something that we experience on daily lives actually. An obsessive compulsive disorder, which is known as OCD, is an unwanted recurring thoughts that drives repeated action. Post-traumatic stress disorder, which is also known as PTSD, is an anxiety that is triggered by certain traumatic events that you could have experienced in your earlier life. Panic disorder is a repeated panic attacks. Social anxiety disorder is an excessive self-consciousness or anxiety in social interaction. And phobias will be an extreme or irrational fear of a situation, object, or living creatures. So these are the most 6 common types of anxiety. Doctor? Oh yeah, you got the screen correct.
Sorry, I have to leave and reset it. Yeah, that's the only way.
Do these anxiety disorders, different types of anxiety disorders, do they coexist with one another?
Yeah, no, normally I mean, they're all under anxiety, and normally one would get you know, one or the other. You know, it's I mean, if you have anxiety throughout, well, whatever it is, But in generalized and anxiety disorder, for example, there's no specific event per se. All right, and we forgot panic attack, right? Panic attack is also an anxiety, where you feel like dying literally, like, and I have in fact a psychologist, from Australia. A couple of years ago, she was with me. We were driving to the tunnel, to KL, from Taman Desa, and she said, "Wow, this is like the longest tunnel I've ever been through." And I'm good if I like freak out and get a panic attack, she was like expecting that.
Right.
Yeah. So they all have in common the anxiety that they're experiencing, and some of the common manifestation like negative thoughts, negative predictions. Yeah.
Right.
So
there are possibilities for one person to have different types of anxiety at the same time.
Yes. I mean, they all have anxiety in that sense, but with some of the other anxiety is more specific, right? Like for phobia, it is like normally specific. I have a patient that she has phobia of lizards, right? And as a result, she would avoid going out in case she bump into a lizard in a restaurant or something, and she would avoid certain places, right? That like places with no aircon, for example, that have more lizards. So it like all form of anxiety becomes a very debilitating situation. It limits their enjoyment of life, of relationship. And part of the reason why we are having this webinar is because COVID certainly in this pandemic would have given rise
yes
to more possibilities of anxiety situation, anxiety disorders.
True.
Yeah.
True. So, doctor, just now you did shared a lot about those coping modes that we developed during the childhood. Could be so. From what I understand, so this anxiety is something environmentally influenced, or is there possibilities for it to be genetically inherited?
Yes, there is certainly there's a physical component, right? And I mean that there's no like anxiety gene per se, right? But certainly there is a number of what we call signature genes that can have the role in the neurotransmitters, which are brain chemicals linked to anxiety. Right. So I was just like giving consultation this morning, on a report back, of a young patient. I think she was in her teens, and she was having problems sleeping. Right. And then of course that anxiety can cause problems sleeping and insomnia as well. And also when we look, she did a neurotransmitter test, that is possible to be done using urine, looking at all the chemicals in the brain. And our neurotransmitters have divided mainly into what we call inhibitory. These are like calming neurotransmitters, right? Like serotonin, GABA. Some of you might be familiar with some of the sleeping pills, Prozac, some of the medication. All these are working on neurotransmitters. Right. So indeed, we did find she has very low level of serotonin, low level of GABA. These are like calming neurotransmitters, and not surprisingly, so that is confirming that there's a physical aspect. Right. We are not saying that this is the only thing that is causing a problem. So we practice. That's why the title of our seminar, is very holistic practice. We look at lifestyle, the nutrition, but in our the report, right? We do see. I mean, if you have a chance, maybe Zoe, you're there, right? If you can blanco out the patient's name, we can share the sample reports, that we have. Blanco out the patient name and details. We might be useful to show that, right? So what we see very interestingly, in that report was the precursors, because with the serotonin, which is the neurotransmitter, is fed, by something called 5-HTP, which is another amino acid, and then there's tryptophan. So all these are quite normal actually. So this tells us that her diet is actually adequate. So she's not suffering from like nutritional deficiency. Otherwise, all the precursor will be low too, right? So she's eating enough protein and everything, and yet they are not converting properly into the serotonin, the neurotransmitter. So she suffers from what we call relative nutritional deficiency, right? So it's not absolute, which you can get from your diet, but relative. So then go back to your question. The big question is, why does she suffer from this relative nutritional deficiency? So something must be like blocking the conversion, and this is where the genetic aspects might come in, right? So because for all this conversion to happen, we need various cofactors, enzyme, and some of these can be what we call down-regulated, right? So genetically, she might have inherited a gene where down-regulate some of this conversion enzyme, and whereby she cannot convert some of the precursors to, So all these would help us to like pinpoint a physical solution, a nutritional medicine solution, which like you mentioned, I train in that as well. And this is the more natural way that we prefer to treat, anxiety in a more holistic and nutritional therapy mode, rather than with medication, pharmaceutical medication. I'm not saying that there's no room for that, but in the long run, once you start like focusing on one neurotransmitter, like if you use, for example, some of the medication like SSRI, for example, which stands for selective serotonin reuptake inhibitor, you're just basically focusing on serotonin, right? And because neurotransmitters, they all share the same transporters. I mean, not all, but a number of them, like dopamine, serotonin, the thal group, yeah. So if you start focusing on one, you're like blocking the rest, and that is why some antidepressant can lead to depletion and of other neurotransmitters like dopamine, and you can get eventually even more depressed, right? So that's the question of whether you have a physical aspects. Yes, that there are certainly physical aspects, but to what extent we the story need to be unraveled, and that's why we have a lab, WellLab, and for those of you interested, I think we will put it in the in the sharing like later, maybe. Zoe can do that, the MalaysiaLaboratory.com. You can see a lot of sample reports. We have a mental health lab test, where we look at all the neurotransmitter tests. Yeah. So the other test we did for this patient this morning was something called cortisol awakening response. It's a saliva test to look at stress hormone, cortisol. That is very much linked to anxiety. Right? Okay. Yes. So when your stress is high, which is can be measured by your saliva, your cortisol, it will literally inhibit, block your melatonin, and that's why you cannot sleep, right? You have racing thoughts and all that at night, and your heart is palpitating, and you cannot sleep as a result. So yeah, so that there are, it's good to know, and then we then need to find ways to treat that. Right.
Right. Doctor, the amount of information you shared is really impressive. Like you go really very in detail to address a patient's problem when they walk in, instead of just like overall telling this is anxiety and you should just change your thoughts or behaviors, you really go very deep. This is
I mean, it's not very helpful to tell a patient you must change your thought and behavior. I mean, they know, in fact, if anything, they feel worse for it. I'm trying, but I can't do it, right? So
yes,
it's
right.
like a double whammy, right? So
that
we
must
need
be
to,
true.
So we need to offer very specific strategies to help effect the change. It's not that they don't want to change. They don't know how
I
to
think,
do that.
I think this must be one of their common frustration, that it's not that they are simply not doing what they're supposed to do. And actually, whatever you shared is really wonderful, because there is this common belief regarding anxiety where medication is the most effective solution, but they're scared that it can be addictive and patient has to live with medication for the rest of their life. So I can see here where International Psychology Center can play their role to break such stigma and offer a very healthy lifestyle options for patients.
Indeed. Yes.
Okay. So, doctor, here's a question. I believe we all experience some type of anxiety at different periods in time, like the night before the exam and a day before the big date. Most of us must be experiencing symptoms like heart racing, face flush, stomach tightening, which we say butterflies in the stomach. And even myself, a few hours before attending this webinar session, I was like a bit scared too. So if these situations are perceived as normal and that is just our brain's way of getting us ready to face or deal with the stressful situation, why we should treat anxiety any differently and seek for professional help?
Right. So we need to know when it is dysfunctional enough. Some amount of anxiety might be quite normal, right? In fact, it might even be useful, right? So the question is when it is too much, that it becomes dysfunctional. It's when it starts preventing us from having a optimum enjoyment of our work, of life, of our relationship, all right? That it becomes what we call clinical or even pathological. Right.
So when they realize that it's starting with the optimal lifestyle, they should start reaching out for help, right?
Exactly.
So talking about reaching out for the help, what are the help options available for this issue in International Psychology Center? So what is the holistic approach that doctor offer actually?
Right. We would want to, like I mentioned just now, address the physical aspects, right?
Right.
So this can be in the form of either performing some lab tests to look at the neurotransmitters, the hormones, right? Some lab tests, or even just go straight and try some supplements, because these are very safe if you do it holistically. But also the dietary change. So in general, we like to combine the physical with the psychological. All right. So if you like, it's a bit like hardware and software, right? When you have something wrong with your computer, if there are issues with the hardware, just recently my camera and my video camera do not work again. I went back to Sony and they told me I need to spend another 600 over ringgit to change a motherboard. that is painful, but that was the second time I've done it. So it's not a matter of software problem. So I just need to have to change the hardware. So we need to recognize for a lot of psychological the issues and disorders, it can be that definitely that there would be the software issues, but hardware contributions are very often part of the picture. Like say take diet, for example, right? So that plays such an important role, in today's system, right? That when we with all the fast food and everything that is so different from the natural healthy food of our ancestors. So that really play havoc, in our guts, right? And we start having conditions like leaky gut, which would then so also part of the cause for the neurotransmitter brain problem we were saying, leaky gut lead to leaky brain, right? So that is the physical lifestyle aspects that we will recommend addressing, if there have been issues there, but certainly also on the psychological part, we will do the history taking and check whether the patient suffering from anxiety have this some of this schema, from childhood, like vulnerability to harm we mentioned, mistrust, abuse, and as a result, they learn to hide, their vulnerable child mode, right? So that kept locked up, right? Like just now, with my patient that really get locked up, and luckily we have his partner there, and we have the request from the partner that she really need that, that part of him, that vulnerable child, for connection, right? And this is the part that we locked up when we have anxiety, right? We don't want to be vulnerable. Instead, we have this thick layer, of behavior that we use to avoid the vulnerability, right? And so part of the, I mean, the with the EFT and all that, emotion focused therapy, in our therapy, we want to help our patient to embrace back their vulnerability, right? To really be aware that it is possible for them to function, right, with vulnerability. In fact, courage, right, is not the lack of vulnerability. It is the ability to act, right, in the face of vulnerability. That is courage. If you have no fear, then there's no need to be courageous. But it's because we have all this fear, and we still carry on doing what needs to be done. This is where true courage is, right? So we need to teach, we need to work with our patients how to be courageous, how to embrace their vulnerability, their vulnerable child, and rather than just avoiding, right? Defending.
Right.
So yeah.
I really like this idea. You're promoting a very different level of acceptance among the patients, and this is really wonderful, right?
Indeed.
So yes. Let's attend to some Q&A session. And audience, you can switch on your camera and ask any questions with Doctor directly if you have any. And meanwhile, I will also be attending to some questions posted in this chat forum. Shirley have question, which therapy is the best if we face a sudden anxiety?
Right. It seems that my camera has viewed again. I don't know why, but
that's okay. We still can hear and see you clearly.
So if necessary, I will go off and on again. But which therapy is well, interestingly enough, right? The American Psychological Society, right? Some years ago, we're using the same patient. Her name is Gloria, and you can purchase this from the American Psychological Society. Gloria, she's a real patient, and she has some issues which then she work, some anxiety issue which she works with, several masters. These are the masters, right? Like the founder of EFT, Leslie Greenberg was one of it.
Right.
The founder of Gestalt, Fritz Perls was one of it, and I forgot. I think Carl Rogers was one of it. I mean, she's really working with the masters. They're all given 1 hour, right? And to see who is most effective. So they're put on the test.
Wow.
Yeah, but generally it was agreed, that Fritz Perls, the Gestalt guy, was the most. I mean, that is just one aspect. But of course, this is not definitive. But I know this is a little trivia that might be interesting. For us, for me, I would look at the specific patient, right?
True.
What is needed, is difficult to generalize this or that is the best, right? So we need to adapt to the specific. So that's why we do assessment, right? Adult psychological or child clinical history that we take, and from there we learn to formulate, do this case formulation and see how the symptoms captured, are developed, right? Clinically, historically, and then only from there we can formulate the best treatment solution, right? So we need to do that rather than having a general answer.
All right. Thanks for answering Shirley's question. Right, doctor, so let me ask, how about the patient's family and friends? Like, because I'm sure living with a person with high anxiety disorders also can take a toll in their beloved's lifestyle.
Totally.
Right.
So the as children, right? We the part of the way we function is to act like sponges. Literally, you see a sponge that just absorbs.
Right.
Yeah. So that is the best, most effective way of learning, right? We need to be like sponges because there's so much things to learn, over such a, and even a human being, we have the longest period of time to learn before we become independent. Most animals, they just have a few weeks or few months, then they are like, left to survive on their own. But for us, it's like 18 years, we are still living with our parents and learning, go to university and all that. So we need to absorb very fast, right, as children. So this is the way we model, right? So we need to make a decision very fast. In fact, Freud, make the statement that give me a child of 4 years old, and I will tell you how he or she is going to die. So what he means is that by around 4, or around that, the child would have learned most of the important life decision, right? That he or she needs to make in order to survive. Like, people cannot be trusted, because there were a couple of times, I needed my parents, they were not there. Then I, this is an important lesson that I learned. People, cannot be trusted to be there for me. I need to survive on my own. So this would be like a schema he adopted, right? So there are all these life lessons, because if he were to or he learns, there must be something wrong with me, and that's why my parents did not like praise me or show appreciation for me, so they can then pick up this defectiveness schema, or the world is a dangerous place, so all this get learned definitely from their environment, from their family members. If they have a parents who always like saying, think things are so dangerous, and they will always like be predicting the worst, and then definitely the child would absorb this, right? And then so this learning by modeling, right? So yeah, so most life decisions were learned very early on, and that is why we it is useful also to have family therapy. But even if the family are not available, we we can do it like in EFT, bring the family in through empty chairs. So we do a lot of family therapy indirectly that way as well.
Right. Speaking about the family therapy, we have a question from Mazdak. Doctor, do you also do IFS therapy, internal family system therapy?
Yeah, so that is quite useful, right? So that because the like family structure, dynamics, or all that is something that will play a very important part in the patient psyche. So it is important to show that, to illustrate how it is formulated, and then sculpted, right, to correct it in a way that is more functional. So that is a very important part of family therapy too, right? Maybe you can chat a bit more, and then I'll see whether I can go out and come back in. You try to answer some of the questions.
All right. Can. All right. Yeah. So Colin Lim, Colin has asked, is EFT one of CBT approach? EFT is emotional focus therapy and CBT is cognitive behavioral therapy. And no, Colin, EFT is not one of CBT approach. So they are different. EFT is another therapy approach where we try to access to patient through their primary and secondary emotions. Meanwhile, CBT approach is more towards influencing and working on their cognitive behavioral approaches. So these are two different elements. But we have attended to some sessions where EFT and CBT can be conducted together. Because CBT, it can do modification to your current lifestyle, and EFT usually address some of the emotions that was left unattended ways back. Maybe the patient have difficulties to express how he's feeling. One of my case will be where the patient was abused, but the patient could not feel angry towards the abuser, but she has anger towards her own self. So in that case, we have to do EFT first, address all the emotions, and after that only we could bring in CBT approach to do the modification in her current lifestyle. So yeah, that's the explanation. Yeah, doctor, you got the screen correct.
Yes, I don't know why I keep on slanting itself, but we'll stay with that. All right, I won't leave you anymore.
Right. So let me go on to the next question. So doctor, actually while preparing for this topic, I come across a few myth or fact statement on anxiety, and I can read them out for you. So perhaps you can share more of your insights on these statements. So number one, anxiety can go away with time. Is that correct?
No, I mean, anxiety just like sadness, depression. I mean, there's people said time heals. I don't think that is always true, right? So there are only like two things that might help people to change. One of course is life event, life experience, especially life, what you call life-changing experience, where there are people that have, like, for example, near-death experience, that like literally come back from what they thought were the death, and they like totally get transformed by that, right? The other thing is true therapy, of course. All right, so this is where our role as therapists is so very valuable to help people change. So time itself, unless you encounter some life-changing experience, and on its own, people can stuck in sadness for years, for 20 years or so, without any change, right? So yeah, time alone is not enough.
Doesn't fix this.
That should be the title of another book. Time alone is not enough.
Wow. Okay, we will be looking forward for it. Right. So number two, there is this belief that real anxiety is only when you are having panic attacks.
No, I mean panic attack, like we mentioned, is one form of anxiety, right? Panic attack is like very acute. You feel like you're dying. You are choking. Your heart, rates go fast. Your face is flushing.
Right.
So that is an acute form of anxiety, but it by no means the only form.
Right.
Yeah.
Right. And doctor, do panic attack will always cause the person to faint?
No, but certainly part of the symptom is the person feel that they might faint.
Oh.
So in fact part of the therapy that I do, is like exposure therapy. I would facilitate, in a very safe environment, of course, in my therapy room, for the patient to run around, to ventilate, hyperventilate, so that they feel that, okay, even though that I get myself to a situation where I think I might faint, but I don't actually faint. So they get to confront and embrace all those fearful situations instead of avoiding them. Right. So
yeah.
so that is part of in fact CBT, cognitive behavioral therapy, which is I work with David Clark and David Barlow, from Boston, that they all do that. I mean, so that is a bit counterintuitive. All these progressive muscles relaxation technique we do. So that might not be so useful when you have a panic attack, because you actually, because that is in a way it's like avoiding the panic. So I mean those can be useful thing you do in general before bed or something. But when you're having a panic, you want to embrace it and I actually be vulnerable rather than trying to avoid it by relaxing and all that. So that is that perspective which in many ways I feel is correct.
Wow. Right? So there has been cases proven effective when handling this approach.
Indeed.
Wow.
Yeah, this is what David Barlow do in his anxiety clinic, getting patient to really confront their panic and fear.
Right? Wonderful. Right. So the last myth or fact statement will be social anxiety is the same as being shy or less confident. Is that correct?
No. I mean, being shy. Some people are shy. Like we mentioned. To what extent it starts to become dysfunctional when it starts to inhibits your social functioning. To be a bit shy, might be part of your personality.
Right.
We some of us are extroverts, some are introverts.
Right.
Yeah, so that might be part of your personality, but when it starts to become a disorder, whereby you avoid all social situation, then it is something a bit more than just shy, or I mean lacking in confidence. All of us, we can check whether that is the case, and then we can always
right.
find ways to increase confidence. That's a little the method I like to use, called stack the deck, right? So we would, yeah, so this is a marvelous ways to develop confidence with patient or clients, right? We will ask the patient, give me like some examples, memory when you have been successful in dealing with things, in dealing with people, that they start giving you some of these specific examples, and you build up their confidence. So you can try that, for example.
Amazing. Right. Shirley have a question, whether music therapy or art therapy can calm anxiety or not.
Definitely. So that is one of the value of expressive therapy in general. So music and art therapy are part of what we call expressive therapy. And the way that expressive therapy work is it helps the patient to process their emotion, right? So we don't believe that they are negative emotions, even anxiety and fear, these are emotions that need to be processed, right? So once you process these emotions, then they become functional, right? So certainly, art and music therapy are ways, by drawing out, their fear, then they are processing already, by composing, playing some music there, doing that also, in that processing, then they're transforming that emotion. So this is another principle, all emotions go through transformation, right? So one of the objective, like you know
in
from
EFT also, one of the
EFT
objectives, right?
is in fact transforming secondary emotions to primary emotions, right?
Correct. Yes.
And you can explain more on that if you want, but that it will be one of the objectives. Yeah.
Right. So, doctor, would you like to speak from your experience on any interesting experience dealing with an anxiety patient? Perhaps something you find challenging or interesting, anything you would like to share?
Well, I find every patient interesting. The work they have their own very interesting journey, of dealing
Right.
with challenges, and it's always a collaboration, a learning experience, with all my patients, so that is no shortage of
Less interesting.
yeah. I
Yeah.
mean, just to give you one that I arose in my mind as we speak, is a little child. I think he's not so little, maybe 11 years old. I think around that boy. And he has this fear, this anxiety of sleeping in the dark, right? They always
Oh,
want to have the light on, and of course that is a bit disturbing. That is like inhibiting his melatonin and all that. So I worked with him on this multiple self ideas, and said, you have this fearful self. Yes, we can talk to him. I use the multiple chair technique, put his fearful self there. We have a chart what you need and all that. But then on the opposite, we also have your brave self, right? Your brave self. So we talk about that. You know what you need, and tell me about the time when you have been brave. You do things even though you're fearful. So that increased his awareness that he has options, have choices. And so when he was fearful at night, and very soon he learned, he also have his brave self, and he was able to sleep,
wow.
without the light on. Just
Yeah.
11 years old, he took on that concept
Yeah.
so readily,
Right. So
so that
actually, doctor, I have experiences attending cases with you, and I do know very well that you promote this acceptance among all the patients. You ask them to embrace all their sides and emotions. But even this case is very impressive because you can do this approach to a 11 years old child.
indeed for a very practical issue, right? Like sleeping in the dark. Imagine.
Yeah. Wow.
Yeah,
How much sessions does it take for this child to
not
gain
many
that acceptance?
not many, just like one or two.
Oh,
Just
wow.
took it on like water. It's like a duck to water rather.
Amazing.
Yeah, it's very natural for us to like really embrace this
Right.
multiple self, and modes of us. Yeah.
Right. Okay. So we have one last, sorry, we have another question from Jen Lee. Does anxiety or panic attack comes with shortness of breath?
It can be one of the symptoms. Yeah,
Right.
shallow breathing, right? Shallow breathing. So paying attention to our breath, having a full breath can really the slow down, or inhibit some of the anxiety,
Right.
but that is only one
one of the symptoms.
Yeah.
Right. And Colin has asked, Doctor, what will happen if anxiety or panic attack not being treated for a long period of time?
Well, it can be maintained, and then you start having a lot of your function of life being curtailed. You might even get into depression as a result of avoiding a lot of situation.
Right.
So it's not ideal. And there's no need for anyone to suffer unnecessarily. It can be treated. So that is the message we want to send out to everyone. Anxiety can be treated. It is to some extent quite normal, right? But it can be reversed. It can be prevented. We can teach our children to really grow up to be less anxious, more confident. All these things can be done. We can develop more resilience against anxiety, right? That is the message we want to send out. Very important message in this pandemic of COVID-19, right? So I wish everyone will be able to have a chance to develop more courage. Having fear, is normal. Having some anxiety is normal, but we at the same time need to learn how to act and carry on with our vulnerability at the same time. Do not show it off, do not avoid, but embrace and be aware, of our vulnerability at the same time.
That's a very, very wonderful message. Something really much needed at this crisis.
Wow, it's lovely seeing all of you, and and thank you so much, Kamini, for this conversation, and for everyone attending. This has been very generative. Yeah.
Right. Thank you. Thank you also, Doctor, for sharing all these details. We hope today's session would have created a profound impact among the audience on how anxiety disorders should be treated and how we can make the changes.
Indeed. Right. Wish everyone a good one and have a nice day.
Thank you. Have a lovely day. Bye-bye.
Bye-bye.